William.
Well, as I said, I came to the organization 35 years ago. As a patient. I'm not a scientist and I'm not a doctor, but I have been around good science and around good clinical work for a long time and benefited from it personally and professionally. I was a journalist in the 1980s, a print journalist, so I had an affinity for the written word and later the spoken word. But in the course of my long journey, as you identified earlier, I went from being a patient, an alum of the organization, to working at Hazelden starting in 1996. And I very quickly became a public advocate for Hazelden. That slide that we have up on the screen there shows me with a lot of my fellow travelers, 40,000 of us, at the Washington Mall for a rally for recovery back in 2015. You noted that I've written a couple of books. Two of them have been published by Hazelden, the other one by Penguin Random House or Penguin Viking, which is as much about my advocacy as anything else, carrying the message verbally, carrying the message in print. And then really the mission of the organization is reflected in that slide that shows my adult children. That's Thomas, and there's Henry, and then there's Nancy standing next to me, and then their grandmother, my mother, Judith Moyers. This is when we dedicated one of the rooms or one of the floors of our Tribeca facility in New York City a couple of years ago. So the point of showing you that slide is that 3 generations of the Moyers have directly benefited from the mission of this organization: love, wisdom of lived experience, and healing and hope. And I don't think there's anything that captures it better than that picture of those generations of my family, Mark.
Thanks, William. I'll also just take a moment here to note that the content of today's conversation is not a substitute for the advice of healthcare professionals. And if you or someone you love is facing a problem with substance use or a mental health condition and you want to get connected with help today, please reach out.